So as long as you're taking it, things are happening. So every hormone has its own sort of profile. So HCG would be the first one I would think of, because really it's just almost as good as testosterone, and even better from the standpoint that you also stimulate sperm production, whereas testosterone inhibits it. The other advantage is that when you give to someone, a man, testosterone, his testicles are going to say, oh, we're getting help from the outside, they're going to work even less. And over time, they'll shrink. That's why when a man is on testosterone, we always give them HCG, 1 weekly injection, generally 3-4 days after the testosterone injection. And the idea of that is 3 benefits. One is to keep the testicles working, therefore avoid shrinkage. And the day you do it, you get a little bump in your blood level from your own production. Another very nice thing. Why not? So HCG is really a must when you're giving a man testosterone, so in terms of balancing it with it and keeping the testicles from deteriorating. But then there is one more item, which is a pill. And the reason for that pill is this. The biochemistry of making sex hormones in men and women is identical. And of course, all these sex hormones come from cholesterol. So the final step in the sequence is, after the DHEA step, remember that we talked about the DHEA as a possible booster, I suppose. Finally, now you have the step where testosterone is being formed. There's only one problem. There is an enzyme called aromatase that both men and women have, and that aromatase is going to convert some testosterone to the female hormone. So when you're taking testosterone from the outside to improve your level, you're going to have more and more of this conversion happening. And if you allow your female hormone level to rise too high, it's going to block all the effects of testosterone and even give you breasts. So for men, that's obviously not a good... And then if it gets extremely high, it may even mess up the sex function. So part of controlling that situation is that you give a man these pills, which are an anti-estrogen or anti-aromatase. And for most people, you only need a couple of pills a week. Sometimes even less, sometimes a little bit more. And we keep that monitored throughout, because every few months you want to get some blood levels. And just as important as checking level of testosterone, we always get level of estradiol, the female hormone, because we want to control it. And for example, for as best as I can determine, I like a number between 30 and 40 for that female hormone. I don't want to see it much higher than 40. I don't want to see it much lower than 30. Because just like too much female hormone is not good, too little is not good either, because one of the things the female hormone does is protect the arteries against hardening of the arteries, so you don't want to lose that protection. So I maintain it at a reasonable level by the number of these anastrozole pills, and also to some degree by the dose of testosterone. Because the number of estradiol, or the level of estradiol, is likely to also rise if you have an excessive level of testosterone. But of course, the main reason you would reduce the dose of testosterone, sure, one of the reasons would be like you don't want the female hormone to rise unnecessarily too high, but the main reason is you don't want to get into side effects of testosterone, for excessive amount of testosterone, such as acne, losing hair, getting more aggressive, and having trouble falling asleep at night. So to really do testosterone in a balanced way in men, you are talking about 3 products. Testosterone, whether it's injectable or gel on the skin every day. Injectable, of course, is once a week. Plus HCG, which is given with an insulin type, a tiny needle, 2, 3, 4 days after testosterone, to keep the testicles working and avoid shrinkage and all of that. Plus the pills, the anastrozole pills, to keep the women hormone, estradiol, from rising too high. And the best dosage of everything is determined by keeping an eye on what the person is feeling, because we want the person to feel his best but not to have any side effects. And then it's helpful once in a while to get some blood levels so you can even fine-tune the doses even more. And it's not something that once you fine-tune everything is going to stay that way forever. That's why to practice this type of medicine you have to really understand, and I explain this to all clients, this is a very interactive service. This is not something that we decide what you need and then you go away like the regular doctors do and they don't want to hear from you until you have a new problem. No, I give you my cell phone, I say call me anytime you have a question, whether it's about food or about hormones, or if a few weeks go by and you've started taking something and you're not seeing any good effects, if you don't call me so I know how you're feeling, there's nothing for me to do. So interactive, by knowing how the person is doing periodically, is very critical for me to do my best service for that client. And more so for women, because in women's case, there's a need for a lot of adjustments, a lot more than with men, until they get to feel their best, which is of course what my objective is, physically and mentally. And the other thing is, I want it to happen in the shortest possible time, not in the longest possible time. But if you don't call me, it can take a long, long time. So really it's a very interactive service to do it properly. And I'm willing to be available to people, and I give everybody my cell phone, and I wouldn't do it any other way.